Here we go. I'm going to start with the video. And just briefly, because I missed hitting the record button, just say again, we're going to hear remarks from Nancy McGraw, our Public Health Director, and Dr. Chyrise Taylor, a nurse practitioner from the county. And please hold your questions until it's time for questions and answers. After that, we'll hear from our president of NAACP. And we'll put up a slide of contact information. I apologize, I'm redundant and forgot to hit the record button. So here we go. Please turn off your videos and your microphone. Bear with me a moment while I get this going.
Of just not having enough information, and I wanted to be able to show people the kind of conversation. I am a congresswoman, but I am uninsured. One day, I just felt like a train hit me. I tested for COVID. I was having difficulty breathing, then it started to get worse. This went on for 2 months. The Black community and our brown community has been hit the hardest. We're being infected more and dying more because of COVID-19, but a lot of people I'm hearing from are saying they just don't want to take the vaccine. I want to keep myself safe, my family, my loved ones, my staff, and everyone around me, my community safe. My thought process was I want to take the vaccination. I was apprehensive just not having enough information, and I wanted to be able to show people the kind of conversation that you can have with your healthcare provider. Hello, I'm Congresswoman Cori Bush, and I represent Missouri's 1st Congressional District. It's in St. Louis. I'm a registered nurse, community activist, organizer, single mother, and an ordained pastor for the people of St. Louis. This conversation today is with none other than the amazing Dr. Jones. And I have a few questions to ask you just so that I can have a better understanding, other people watching can have a better understanding, and our communities members who have to make this decision will have a better understanding.
Well, thank you, Representative Bush, for even engaging in this conversation. As you say, this is a really important conversation for all of our communities.
Dr. Jones, for those that don't know you, please tell us about yourself.
So I'm Camara Phyllis Jones, MD, MPH, PhD. I am a family physician, epidemiologist, anti-racism activist, and a past president of the American Public Health Association.
So firstly, it's really important to address the elephant in the room, which is the reluctance of many Black people like me to even get the COVID-19 vaccine. What would you say are some of the biggest concerns Black people in particular have about COVID-19 vaccine at this point?
The biggest issue is that this government has never shown itself to be about the health and well-being of Black people. I mean, honestly, even if we don't know the names like Dr. J. Marion Sims, the father of gynecology to some, but who used enslaved African-descended women to experiment and to perfect his gynecological surgeries without anesthesia, for example, or the US Public Health Service study of untreated syphilis in the Negro male, often known colloquially as the Tuskegee study, but they don't even need to know about the historical things. They might just need to know how they were treated the last time they went and interacted with the healthcare system. So you have this background of disregard, devaluation, dehumanization, and then you want me to take a vaccine? Is it only because you want to get to herd immunity, or is it because you really care about me? So I recognize all of that, but these vaccines are, pardon my French, damn good vaccines. These vaccines offer a lot of protection against a disease that is devastating our community. Nobody should be in the position of trying to convince anybody to take something, but we need to honor people's questions, answer them truthfully, where many of the answers might be, we don't know, or we don't know yet. But I just want to say, so I'm clear and on the record, as a physician, as an epidemiologist, as an anti-racism activist, I have looked closely at these two vaccines. I have decided that they are so effective. For me, as a person, I'm going to take it when my turn in line comes. Rather than risk dying from COVID-19, we're more exposed. Then when we get it, we're more likely to die. So many things we don't know about the long-term side effects of the virus itself. This pandemic is having such dire effects in our communities that we should seriously consider protecting ourselves in all the ways that are necessary.
What can the medical establishment do to put a stop to a lot of the concerns that we have right now? Because we know that there has been this long history, like you said.
All of that history can't be unwritten right now. What we have to do is make sure that we get the vaccine to those communities that need it most. They're saying nursing homes, but what about prisons? What about detention centers? And the like, which are also long-term care facilities, right? Or even if you're talking about nursing homes, which nursing homes are going to get it first? We haven't been prioritizing those communities that have been hardest hit, and we can identify those communities. You know, it's not that a community needs to trust, it's that the government and the medical establishment needs to be trustworthy by saying, here's the vaccine, we're going to make sure that you who have been hardest hit get first access to it. Most people don't understand that this virus has one job and one job only, which is to replicate itself. And if there are no controls in place, this virus will spread exponentially. Imagine that there's this big old lake, big old empty lake, and I plant a lily pad in this lake. This lily pad doubles itself every day. So on the day I plant it, on day 1, there's 1 lily pad in the lake. On day 2, there are 2 lily pads. On the next day, day 3, there are 4 lily pads. On the next day, day 4, there are 8. And the next day, 16, and so forth. Here is the riddle. If the lake becomes completely filled with lily pads on day 40, on what day was it only half full? It was half full on day 39. That is what exponential spread looks like.
Are there any things that people should be looking out for, or pre-existing conditions that would make you as a provider say, you know what, maybe we should wait on the vaccine for you?
I would say if you're highly allergic, especially if you have had an instance where it became hard for you to breathe, or your lips swell up or something, or if you are a person who's so allergic that you carry around an EpiPen, then you need to talk to your provider, and you need to talk to the people at the vaccine administration place, at the clinic or wherever you're going to get it, and tell them that you're highly allergic. It doesn't mean that you can't get the vaccine, but it means that they need to be ready and watch you carefully and have you sit there for at least 30 minutes after you get the vaccine so that they can make sure that you don't have any of those allergic side effects. The only real contraindication would be if you had the 1 dose of the vaccine and you had a bad reaction, then probably you shouldn't have the 2nd dose. But all of these other things, the diabetes and all that, these are not reasons you shouldn't get the vaccine. These are more reasons that you should get the vaccine. When they inject you, that fat bubble is going to allow the little snippet of messenger RNA. It is not the virus. It's a little bit of messenger RNA that goes into your cells and uses the machinery of your cells just to produce the spike parts of the virus, so that our immune system can recognize the spike and say, oh, there's something really wrong going on here. Let's get prepared. The reason you need 2 doses is we sort of prime the body with the first dose to recognize the spike, and then we boost the body in 3 weeks with the Pfizer vaccine and 4 weeks with Moderna, so that we can have a full-on response if we as people ever encounter the real virus, and we go into full attack mode and we immobilize it before it makes us sick. We don't know if it's going to stop us from getting enough that we could spread. We do know that these vaccines will stop it so that 94 to 95% of us who get the vaccine will not get sick.
Oh my gosh, that is such perfect information. That is so wonderful. It's definitely good for people to know that they're not getting the virus, because we know that that has been a pushback with other vaccines. Also making sure that people understand the importance of getting that 2nd vaccine. One thing that I've seen as a nurse is we'll get the first in a series. We're told to come back 6 months, or we're told to come back in a year, or whatever it is, depending on what you're taking, and then we don't. Are there any negative side effects to the vaccine that people should know.
When they get the vaccine, their arm might get sore, maybe even more sore after the second one than the first, that they might feel a little tired and need to take a nap that day. Rarer is maybe you get fever that you could take, some ibuprofen or aspirin with, or some muscle aches. Those side effects are showing that the vaccine is working, that your body is gearing up in reaction. These are not unexpected side effects, but that's it. After a day or so, you shouldn't have anything.
So as you know, I have not taken the vaccine yet. I have had reservations. You've answered a lot of the questions that I've had that I've been trying to get from so many places, and you've hit them directly, so thank you. Currently, I am an uninsured Congresswoman. I've been uninsured for quite some time now as I was running for this seat. More than a year. I went through what the doctor said at the time was COVID-19. So do I need to take the vaccine? Now, what care do I have as an uninsured person? And that goes for anybody who's uninsured, that would like to take the vaccine.
So the first thing I want to say is that the vaccine is being administered free. And then you've already had COVID. I think they're asking 90 days from when you were sort of clear. Then you can take the vaccine after that. You also have to protect yourself in other ways, like, what's the craziness of those congressmen refusing to wear masks when you guys were all hiding from the insurrection? So the vaccine, I would say, is not the only cure, it's not the only protection, but it's a very important individual protection you could put on. But everybody needs to be wearing their masks still, whether you took the vaccine or not. Everybody needs to be keeping their social distance and the like. People who are in communities where there's a high amount of virus circulating today, like Los Angeles, those should be prioritized and being offered the vaccine.
On our end, as lawmakers, we should be looking at how and working with these companies to find out what can we do to make sure that even when somebody is uninsured and they come to get this vaccination, like you said, that's free. And so maybe that's something that we should be looking at as well. I absolutely appreciate you for all that you are doing. Thank you for helping me to see even my own, what I need to do for myself.
Thank you so much. Thank you for all of your work. And I am just so looking forward to seeing what you do as a lawmaker. I am so excited.
Thank you. And I'm going to go ahead and get the vaccine. You have given me what I needed, so I'm going to go ahead and get it.
So I hope you enjoyed that. Feel free to turn on your video cameras. Maybe keep your mics muted until it's time later for questions. And let me just introduce our first speaker. This is Nancy McGraw, who I hope you will unmute, Nancy. Nancy is our public health director for Sullivan County since 2013. She has 21 years of experience in public health and holds a master's in public health, an MBA in healthcare administration, and an MSW. She serves on the board of directors for the New York State Association of County Health Officials, NAACP, and the New York State Association for Rural Health, as well as several advisory boards and committees throughout the county to help promote the importance of bringing programs and services to the underserved community residents. So I'm going to turn it over to Nancy now.
Thank you, Carol. Thank you for the introduction. And it's an honor to be invited to speak tonight on your forum. And I do have some slides. I think are you going to bring those up?
Yep, whenever you say. Should I do it now?
Yeah, go right ahead. I'm going to talk about briefly vaccine safety, and then I'm going to talk about what we've been doing with our vaccination clinics at the county level and where people can go for vaccines and how to find information. So I'm just going to go over these fairly quickly because some of the issues were addressed in the video. That was a really great video. Vaccines really are critical for ending the pandemic, not just the vaccines themselves, but the number of people that choose to get vaccinated, because it's the number of people who get vaccinated in a population for herd immunity that is going to help end the pandemic. Next slide. A lot of people have questions about the clinical trials process. I think you can click the down arrow. There's something missing in the middle there.
Oh, okay. Thank you.
Go. So, you know, a lot of people were or probably still are a little bit skeptical about the speed at which these vaccines were developed, and even the previous administration dubbed it Operation Warp Speed, which made many people, even myself, pretty skeptical. But once you look at the science and the evidence that was reviewed by the FDA and all of the scientists, the clinical trials process for each one of the 3 vaccines that are now available to us in the United States went through a very rigorous scientific process with all 3 phases of clinical trials. So that means including small groups of healthy volunteers to test for safety and potential side effects. And then phase 2, several hundred more participants that represent the population to get the vaccine and test the response for a diverse immune system. And then phase 3, thousands of volunteers received the vaccine to test widespread efficacy, side effects, and safety before it was approved for emergency use authorization by the FDA. So this is the scientific process that all vaccines must go through before they can be released and determined safe and effective for all people, regardless of their age, race, ethnicity, or gender. Next slide. The vaccines use what's called an mRNA. It's a mRNA vaccine. M is for messenger, or RNA vaccines. They're a new type of vaccine, and they're designed to trigger an immune response. Some mRNA, I can't say that very quickly, vaccines are based on 1 dose, but others require two doses. So the most recent one being approved, which is Johnson & Johnson, requires 1 dose. The Pfizer and the Moderna require 2 doses. The really important thing to point out is that, and we'll probably address questions later, but there's no live virus in any of these COVID-19 vaccines. So you cannot get COVID-19 from the vaccine. Next slide. I was technically challenged in trying to remove the highlighting on this slide, so that's why it's yellow. In terms of addressing the disproportionate impact on communities of color, many of the issues that come up involved environmental factors such as access to healthcare. A lot of people of color tend to be overrepresented in high-risk jobs, frontline workers, essential workers, public facing, have a lot of interaction with the pandemic. And so just that factor alone, they're higher risk, in addition to comorbidities and other medical conditions. And the elderly are also at higher risk. In Sullivan County, you know, very sadly, we had to report 1 additional death today due to COVID since the pandemic started a year ago. So we have 67 deaths in this county. The mortality rate is less than 1%. And while that's low, it certainly is something that we want to keep low and not see go up. We haven't had a death for a couple of months in this county. Fatalities by race and ethnicity were not available to us by county. I looked today for an update on the data from the State Health Department website, and it was not available as of today. So this data is available as of Sunday, the 14th of March. So 13% of African Americans are represented in upstate New York in terms of COVID cases that result in fatalities. but yet they represent 9% of the population. I'm talking just about the upstate New York population. 10% of Hispanics are represented in the fatalities in upstate New York, but they represent 12% of the population, and so on. So you can see there's a disproportionate impact. This makes it really important that we try to ensure high levels of vaccine acceptance in communities of color in order to help save lives and help end the pandemic. And that's based on our county's, the data above 2019 census. Next slide. A lot of people ask about the side effects. You know, they have concerns and worries. There's a lot of misinformation, or what we call disinformation, circulating on social media and the internet. And we'll talk later about credible sources. But as with all vaccines, mild side effects should be expected. Your arm could be sore, red, or warm to the touch. Some people report getting a headache or a fever for a short period of time. That just means that the vaccine is building up protection against the virus and your immune system is working. Typically those symptoms go away in 1 or 2 days. Additional safety measures include the CDC's V-Safe program. And every time people go through a vaccine clinic, they're handed a fact sheet and a piece of information that shows where to go or a phone number to call to report any side effects that concern you, any of them whatsoever, so that can be monitored. And it helps with the data collection on the safety of the vaccine. Next slide. I can tell you that of the almost 5,000 people that have gone through our public health clinics since January, we have only had, I think, 4 mild adverse reactions. We have not had any serious anaphylactic reactions. So that is very good. And the data shows that it's very safe. Vaccines are just a really important step in controlling the pandemic, but we also need to remind everybody to wear a mask when you're outside your home in groups or crowds or within buildings, at events or work or wherever, public gatherings. Maintain social distancing and wash your hands frequently. We're all probably could rattle this off like the ABCs at this point. We've been saying it for so long, right? But even when you're fully vaccinated, when you're in these situations, until 75% of the population is vaccinated, we all need to continue to do this when we're in groups of people who may be higher risk or who are unvaccinated. Next slide. So on December 14th of 2020, the first people in the United States were vaccinated, but it doesn't mean we can return to immediate day-to-day activities. Some of the national experts are estimating that the vaccine won't be widely available to people in lower risk categories that are not yet eligible until the spring or summer of 2021. In Sullivan County, we've vaccinated over 5,000 residents since, I believe, January 21st, and 14,439 Sullivan County residents have received at least 1 dose, so that's 19% of the population. And 7,382 residents have completed the 2-shot vaccine series. That's data as of today, March 18th. Next slide. So this is our website where you can find more information. CDC.gov, vaccines.gov, FDA.gov are very good, credible resources for finding any information that you need about the vaccines. And I'll just end it there.
Thank you very much, Nancy. That was great. And I want to let everybody know at the very end, we will have a slide with the public health and other contact information. So how you can, if you didn't get to write it down now, it'll be up later and we'll leave it up at the end. Okay, so let's see. Now I'm going to introduce Dr. Chyrise Taylor. Chyrise is a doctor of nursing practice and is a board-certified nurse practitioner in family practice. She practices in Wurtsboro, New York, to an underserved population. And she has lived in Sullivan County for 30 years. It's all yours, Chyrise. Don't forget to unmute.
Thank you for reminding me, Carol. Good evening, everyone, and it's a pleasure to be here. And thank you, Nancy. That was a great presentation. Thank you very much. My goal tonight is not to preach to you, but it's to answer any questions that you may have. I find that people are able to make better healthcare decisions, just as Representative Bush said, that you're able to make better healthcare decisions when you have the opportunity to ask questions. So that if you have questions about the COVID vaccine or about whether or not you should get it or your family member should get it, you really do need to, I mean, I'm available tonight, of course, but you should have a conversation between yourself and your provider and sit down and discuss the issues that, you can bring up. I will tell you that one of the reasons that I am here tonight is because, as Nancy said in her slide so well, African Americans are 1.5 times more likely to not only get COVID, but die from COVID. African Americans are 2 times more likely, and Latinos are 1.5 times more likely. This is a very dangerous virus, and its only job is to replicate and replicate and replicate. So, one person said to me, is its job to kill us? No, its job is to simply replicate itself. In the effect of that does kill us, but its job is not to kill us. And I have to tell you that my brother-in-law's sister contracted COVID, and she contracted COVID on Sunday, went directly to the emergency room. She was hospitalized and she was dead the next Sunday. This is and I cannot tell you how it just shook the entire family. And this was back a year ago when in Brooklyn, there were the refrigerated trucks and everything. And she was gone. She was gone in a week. So getting this vaccine and getting people to understand the importance of getting this vaccine it's life-changing and life-saving. And that's why I'm here tonight. Now you are muted.
Okay, thank you very much. Thank you, Chyrise. And I hope you'll talk more in our question and answer period about how that has impacted your practice with your patients. So right now I'm going to, before opening it up, hold on, now I just lost you guys, bear with me. I want to share a slide just to guide our question and answer period. So for our question and answer period, just a few little instructions. If you could either raise your hand physically to ask a question, or if you happen to have a reactions button, or sometimes it's in the participant button, where a little figure of a hand raising, you can use that. But if not, just go ahead and raise your hand. When you're called on, please tell us who the question's directed to, whether Nancy or Chyrise. Please try to keep your comments and questions concise so everybody gets a chance to speak who wants to. And please, when somebody's speaking, just common courtesy, let's not interrupt. And if things get stuck or anybody's going on too long, I reserve the right to step in. So I would say turn your videos on if you're comfortable. And when you want to speak, you'll have to remember to turn your mic on. Would anybody like to start it off with a question?
I have a question about the locations of the the places in Sullivan County where you can easily get the COVID vaccine. So that question is for Nancy.
Okay, thank you. So we have been very challenged in Sullivan County in getting vaccine into the county in large numbers until very recently. So in the last 2 weeks, we have gotten 1,000 doses per week. And on top of that, we've gotten more that we've redistributed to our healthcare partners that we're in touch with constantly. And that is Garnet Medical, Catskills at the hospital, Sun River Healthcare, which is our federally qualified health center in Monticello, the Center for Discovery. And there is a list now of all the pharmacies. There's a map locator, which we've put on our website from the Westchester Medical Center Regional Hub, which has all of the pharmacies listed. You can search the directory and get the phone numbers and websites of these pharmacies that have vaccine, and they're getting vaccine every week. Unfortunately for the pharmacies, they're still restricted to people 60 and over, and now they can do teachers as well that have not already gotten their vaccine through us or through Garnet. We've vaccinated over 1,400 teachers in this county through public health since January, and we're pretty much through everybody who wanted one. Then they can go on if they have vaccine left, which they, as vaccine becomes more easily available, the pharmacies can then move on to any eligible person. Now, I just got some good news earlier today, and that's that Sun River will be having a vaccine clinic this Saturday, which is the 20th. And we have shared information with some community advocates and this group to help start getting people signed up, and that will be open to any eligible person. So you can be 60 and over, you can have comorbidities and underlying health conditions, or you can be an essential worker. And there's a long list of essential workers who are eligible. So that's good news. There's also the state sites, and 2 brand new mass vaccination sites will be opened up tomorrow. One in Ulster County at the fairgrounds and one at Orange County Community College. Now, granted, that is out of Sullivan County, but we're conducting clinics at SUNY Sullivan twice a week now. And we will also be able to vaccinate any eligible individual going forward with our vaccine. The state is starting to get more flexible about that. So we'll make sure to share that link that's on our website on that map locator.
And if people would like an appointment at the Sun River Clinic, they can contact any of us, or you can, I just got a text here I'm looking at. Dana from the Committee for Equity and Justice says you can call her Google Voice number and she'll sign you up. Her number is 845-320-2598. Or Juanita, who just put something in the chat. You can also contact her. So her email's in the chat.
And there's
Thank you.
100 vaccines available for Saturday, and each of these locations should continue to get vaccine every week.
Thank you, Nancy. We've got a question from Adrienne Jensen. Welcome, and we hear you're the new Human Rights Commissioner, so yay, welcome.
Thank you very much. Thanks for having this forum also. I appreciate it. I am wondering what the difference is, and it's possible that you covered this because I came in a little bit late. So I'm wondering what the difference is between the Pfizer and Moderna vaccine, and which one has had more deaths attributed to it. And then I don't know who to direct the question to.
Oh, that's okay. Hi, Adrian, and congratulations. My name is Chyrise, in case you missed my intro. And so I'll take your question. The difference, so your first question is, what is the difference between Moderna and Pfizer?
Yes.
Okay, Moderna and Pfizer are both messenger RNA vaccines. So there really isn't a difference, except that with the Pfizer, you can vaccinate children 16 and above, and you'd get it every 21 days. With the Moderna, it's 18 and above, and you take it every 28 days. Okay, so you take it not every 28 days, I'm sorry. You take the first dose, and then second dose is 28 days later.
Okay.
For Moderna, and then Pfizer, it's you take the first dose, and then you get your second 21 days later. Now, I think the second question you had was how many deaths are with both of them.
Yeah.
Quite frankly, I don't have that number for you, but I will get it.
Okay.
And it's minuscule on both. There was some question about Astrazeneca. You might have heard that one, which is not here in the States yet. But that is the one that seemed, but it's been cleared now by at least the European authority. It seemed that it was leading to more deaths from blood clots. And, but again, it's not available in the United States. And today it was cleared by the European Union after they did, more studies for it.
Right. Thank
Okay,
you.
You're very welcome.
Adrian, don't forget to take your hand down. It'll stay up there in perpetuity. Is there anyone else that would like to ask a question?
Hi, I'd like to ask a question, and Chyrise or Nancy can answer it, if I may.
Who is talking?
This is Josie Omar.
Okay. Hi, Josie.
How can we reassure people? I think people who are generally hesitant about taking the vaccine are worrying about the venues that are giving out the vaccine. And I'm trying to reassure them, as long as they can get a shot in their arm, it doesn't matter. So how can we reassure people? Because people are saying, maybe I should get it at the hospital, or maybe I should go to the pharmacy. But I'm saying you can go to SUNY Sullivan, you could go anywhere. You can go to the racetrack, just get a shot in the arm. How would you reassure people about the venue and how it's administered?
So I can briefly say something. I see Chyrise probably wants to say something as well. We have medical evaluation on site at all of our clinics. It's required. So we have a physician or a nurse practitioner or an EMT who's always there. And that's true for any other setting as well.
That's exactly what I was going to say. It doesn't matter where they get the vaccine, you're going to have medical oversight there. So it doesn't matter. It's not, I think people think of getting the flu vaccine and, you go in and it's just you and the pharmacist behind a little screen. It's entirely different for the COVID vaccine.
Thank you, Chyrise. Jody has her hand up.
My question is, as far as vaccine rollout to like homebound seniors or people who need assistance being transported, who is serving those people? Is our home health nurses doing that, or how are those people being able to get their vaccinations?
So I can address that question from a public health perspective. We're developing in conjunction with the regional hub and the state health department. We're having many discussions and meetings about that. The biggest issue is in a rural county, it's much more difficult and spread out. In terms of transporting the vaccine, you have to keep it cold. The state wants us to use the Johnson & Johnson because then you only have to get one shot. But, excuse me, once you open a vial of Johnson & Johnson, you have to use it within 2 hours. And it has to be kept at a certain temperature. And you also have to observe and monitor the person in the home for a minimum of 15 minutes. So if you've got 5 or 6 doses in one vial, you have to plan. It requires a lot of planning ahead of time. Let's say you go to a senior housing complex. You've got to pretty much sign people up ahead of time, make sure that they're eligible for the vaccine, that they haven't already gotten it, that they will be there on that day. So the plans are in process, but logistically, it is a little bit more complicated. We are working on that. We do have a home health agency with nurses that go out to the home. And so those patients will also be offered vaccine. But as you can imagine, going from home to home, sometimes there's, half an hour, 45 minutes to an hour in between homes for home visits. So we're looking at a model of an EMT and a nurse going out. So a lot of counties are kind of in the same situation. And right now our goal is to make sure that we get the most people vaccinated as quickly as we can at our mass vaccination sites with the limited staff that we have.
Thank you, Nancy. You take your hand down, Jody. Anybody else? So I have a question for Chyrise, like I mentioned before. How did having that experience within your own family impact your practice? And then after my question's answer, we'll go to you, Jason. I see your hand is up.
How did it impact my practice? It made me become a full-on advocate. I mean, I'm a full-on advocate for the COVID vaccine. I'm more than willing to talk to people and help them through the process of, making the decision. But I don't see a reason not to. When you look at the comorbidity list, even that has allowed people to get it sooner. I mean, it's filled with comorbidities which affect the African American and Latino population. I mean, you're looking at hypertension, you're looking at diabetes, you're looking at even pregnancy. I mean, these are things that make you at high risk. Asthma. I mean, the list goes on and on and on. It goes down a whole web page. And these are all things that make you more susceptible to having serious, with hospitalizations and needing to be on a ventilator with COVID-19. So I am absolutely 100% getting that message out, not only to my patient body, but if you see my Facebook wall, it's all about it.
That's true. I've seen it.
I know.
Thank you, Chyrise.
You're welcome.
Jason, can you ask your question and who it's for? And don't forget to unmute.
Can you hear me?
Yep.
Yep.
Okay, I can't get my camera working. Sorry, I don't always do these things. I'm actually not sure who would be for, and I hope that it wasn't fully addressed already because I think I missed a couple things. But just following what Chyrise said there, talking about the comorbidities, and it was something that Nancy had mentioned earlier, and I know that this is an issue for people of color. I feel like it's also an issue for a lot of like low-income folks all over the rural area with the
Correct.
comorbidities and everything. And then when you get the low income thing going on too, you got people that might not be fully on top of their health care like they should be, and maybe don't have a primary and things like that. Are there steps that they should take for getting the vaccine apart from what they ought to be doing with the rest of their health care, or they need to get hooked up with a primary care provider first and talk to them before taking the steps to get the vaccine?
Jason, that's an excellent question. And frankly, the reason that I work where I work is because this is a very underserved population. People think that just because someone is employed, that they're not underserved or outside people. But believe me, this is a very underserved population. And I serve people of all races in my office. And so, yes, you're absolutely right. The working poor or being having a low income does mean that you're probably not connected with the healthcare machinery. But what needs to be done is forums like this and talking to people. And when you see people at the supermarket, and there you are, hi, you've got your video going, okay? When you see people at the supermarket, when you meet people where you are, wherever they are, talk to them about getting the vaccine. Show them, tell them about, they may not have the opportunity to have internet in their home, but every single town has a library, and every single town's library has broadband. So they can get help to get on the internet and use the tools that Nancy has shown. Vaccine Finder is wonderful. It really is. People need help to access healthcare, yes. And people need help in order to try to get this vaccine. But it's important that each of us become an advocate for anybody we come in contact with, not just our only little groups, so that we can help people who don't have computer savvy or don't have internet access, or even though, that they can get the vaccine. And that's a great question. And I do agree with you, low-income people fit these comorbidities as well.
And Nancy just put something in the chat with a phone number where you can call to find out how to get a vaccine. The state has a COVID-19 hotline for vaccination. And I think if I could be so bold to answer something you asked, Jason, I don't think, unless somebody here disagrees, Chyrise or Nancy, that you have to wait to have a primary care provider to go to get a COVID vaccine. I think you need to get your vaccine. And then you still should work on getting a provider, but don't wait.
That's correct.
One of the issues that is with the comorbidities is you have to prove that you have it. You have to have a letter from a provider, but Nancy, am I correct that you could bring your vial of high blood pressure medicine?
Yes.
You could, right? You could bring
Yes.
your medication and say, this is what I take for high blood pressure. And, therefore, I qualify. You don't have to, now somewhere along the line, you got that vial, right. It may be expired, but at least you can prove that you have it. You have that condition.
I'm glad you brought that up, Chyrise, because when we started vaccinating people with comorbidities, the state had very, very rigid rules.
Yes. Mm-hmm.
They were basically saying, if you don't follow these rules and we audit you, you can be fined $100,000 or you could lose your ability to get more vaccine.
Wow.
Now that vaccine is more available, and we have not just but county health departments and healthcare providers across the state, hospitals have shown we're going to do the right thing and prioritize and vaccinate the people who need it the most.
Mm-hmm. Mm-hmm.
That we were and some are still requiring, you know, a letter from the doctor or maybe a summary sheet from your last visit, which shows your diagnosis, or a medication bottle. But excuse me, there is a third option. If somebody doesn't have either, that is when they come to the clinic, they sign an attestation form
Right.
that
Okay.
says, yes, I'm signing my name and I am telling you that I have this condition and I qualify. And we will get them through.
Excellent.
So
That's excellent news. Thank
that
you.
is just a very recent change, because we have been advocating to relax the rules and let us get the highest risk people vaccinated.
That is
Mhm.
great news. Thank you. Thank you. So we only have about 4 minutes. This
Oh,
has
wow.
been great. Yeah, this just went fast. I'd like to ask Sandra to come back on to talk a little bit about the NAACP. And after she speaks, I'm going to put up the context slide so you can all, and I'll leave that up for a bit so you can copy down whatever phone numbers, emails, or websites you need to. Okay, Sandra?
Yes, here I am. Okay. Hi. I just want to thank the Dr. Taylor and Nancy McGraw. This was fantastic. You gave out a lot of pertinent information, and I'm hoping that it helps people, take the message to others and help others who are on here who are eligible at this moment, and eventually everyone will be, feel more at ease about taking the vaccine. I just want to say I had my second dose this week of the vaccine, and I felt nothing. I was so, wound up like, well, what's going to happen when I take the second dose? Nothing.
Great.
Matter of fact, my arm was sore the first time and not this time. But I know
Wow.
everybody is an individual and everyone processes these things differently. So, but thank you very much. And Carol, thank you for putting this all together. It's been wonderful.
Oh, you're welcome. And I was hoping you'd talk a little bit if anybody would like to join
Oh,
NAACP.
that's my next
Okay,
my next conversation is I just wanted to, we always need people who are interested in civil rights and in getting things out to people to help others. And so, the NAACP is the oldest civil rights organization in the country. And we try to do a lot of things behind the scenes. Many times people don't know all of the things that we're involved in, but we welcome anyone who's willing to join and to be to help make Sullivan County a better place. And it's for all races. Some people get stuck on the fact that, well, should I be there? Yes, it's for everyone. As we see now, there's a problem right now with the Asian American community and all of the backlash that they're receiving. And we just all need to be part of, making our lives better and making our neighbors' lives better, because it's really not, everybody's human. And so if you're interested in joining, just Carol will put up just send me an email. I'll send you an application, and we can always use co-laborers. So thank you again for everyone who's here, everyone who took time out of their evening to join us. We really appreciate it. And it will be rebroadcast on WJFF. It will be on the school's websites. And so thank you for getting the information out. It's vital that we all get immunized to help stop this pandemic.
thank you very much. Thank you, Sandra. Thank you, everyone. You've been fantastic. I'm putting the contact information up now, and I'll leave it up for a bit for anybody that wants to copy down any of this information. And thank you again, Nancy, Chyrise, Sandra, and Mary Page from the library.
Yes.
It's been a great support and partner. And Jason Dole from WJFF, thank you you're going to put a recording up. So thank everybody.
Yeah,
Thank
March 7th, I'm sorry, March 31st at 7 p.m.
Okay, great. And thank you all for attending.
Thank you, everybody. Have a great night.
You do the same. Thank you.